Hi friends, I hope everyone is doing great. So guys, this is Dr. T, and once again, welcome to Clinical Medicine with Dr. T. And yes guys, if you have not subscribed, please consider subscribing, and whatever content that I upload, you don't miss a thing. So please continue to share, to like, and yeah, to comment. And thank you so much for supporting. Okay, so guys, I want us to continue with our circulatory failure. We've been talking about shock. In this video, I want us to look at anaphylaxis and anaphylactic shock. So anaphylaxis. Anaphylaxis is one of those medical conditions that each and every doctor should know. Each and every doctor should be able to diagnose it and manage it appropriately. It's one of those conditions that just cuts through all disciplines. It doesn't matter if you are doing surgery, if you are an obstetrician, or if you are in peds, or if you are a radiologist, or if you just need to know, because as long as as long as you are still in a position whereby you still give someone medication, you still prescribe, you still give someone injections, you should know anaphylaxis. Maybe if you are doing research, you don't have to, but as long as you are still prescribing medication, you have to know anaphylaxis. So anaphylaxis, as we all know, it's a severe allergic reaction. It's a severe allergic reaction. As an intern, you are gonna be asked, it happens with us a lot. Where I'm working, at least. So it's gonna happen that when you, or maybe your senior has got a patient that needs to be done a contrasted CT, they will ask you to go and give the contrast, and also to be there with the patient. The radiographer will not give contrast by themselves. They will expect a doctor to be there. And the reason for that is not just to make sure that the IV is running. Yes, we do it, but the main thing is anaphylaxis. They want a doctor to be present when the patient starts to change condition after having received their contrast. So yeah, it's very important to know. It's one of those things that, if you pick it up and manage it, you will save a life. There's just no two ways about it. You will save a life. So it's a severe allergic reaction. It's life-threatening. And what makes anaphylaxis or anaphylactic reaction different from other allergic reactions is the fact that it's multisystemic. And it's very acute, meaning seconds, it takes about seconds to develop to minutes. Some articles, they say that by 5 minutes your patient will be gone if nothing is done. That's how fast it progresses. So if there are things that you guys should really pay attention to is the fact that this thing, guys, these 4 points that I've just mentioned, they're very important. The acuteness, it means that you don't have time. You just don't have time. You don't have time in diagnosing. You don't have time in treating it. So it means everything that you do must just be on par. It's multi-systemic. That's what makes it different. It's multi-systemic. It's not like contact dermatitis. With contact dermatitis, the patient is going to have symptoms just localized to where there was contact from whatever they're allergic to. It's not like... So that's the difference. That's the difference. If you are wearing a necklace or a bracelet that has got things that you're allergic to in them, you're just gonna have, it's gonna just be localized, and you're just gonna see it's gonna go around the neck, or it's gonna go around the wrist to show that it's a contact. So that's what makes it different. It's multisystemic, it's life-threatening, it's a severe allergic reaction. Unfortunately, allergic reactions are it's a problem of the immune system. I mean, an allergen does not come in, an antigen does not come in and say, I'm an allergen, I want to be an allergen. It's the body that makes an antigen to be an allergen. Right? The immune system is the one that's supposed to protect us. Right? Okay, let me just try and write this thing down. Okay. So these are the other... When we talk about anaphylaxis, we're talking about this. This is what you should... So when we are talking about anaphylaxis, we should know that it's a severe allergic reaction. It's life-threatening, it's multisystemic, and it's very, very acute and progresses very, very fast. So when someone mentions anaphylaxis, this is what should run through our mind. Okay. So what are the possible causes of this? So it's food stuff, it's medication, it's stings or venoms, and other things that are in the environment. Things like pollen, grass, and other things. The most common foods, it's peanut butter. Actually, the problem in peanut butter is the peanuts. It's your seafood. It's your, some people, red meat gives them problems. Even though majority of the people, when they've eaten red meat, they just get GI symptoms, nausea, vomiting, abdominal cramps, diarrhea, things like that. But we cannot say, as long as something can give you an allergy, you can get an allergic reaction to it, you can get anaphylaxis. So yeah. So medications, there are so many of them, but penicillins are known for this, especially parenteral. Some NSAIDs like aspirin and all of that. Yeah. So, but what happens? Why would someone eat this and then they become allergic to it? They get an allergic reaction to it, and then another person eats the same food stuff, but they don't. That's where the difference is. So the main thing here in understanding anaphylaxis is we need to understand the immune system. So this is immunology. It's a problem with the immune system. So I'm not going to get into the details of the types of immune systems in terms of details into the cells and the innate or the what. I'm not going to get into those things now. So, but basically what happens is that we've got an immune system, and this immune system is made up of, let's say there's B cells. B cells, when we are exposed to an antigen comes in different, they're different. Like an antigen can be a bacteria, can be a virus, fungi, and other things, but these are the most common ones. So these guys, when we get infected with these cells are supposed, in other cells as well, they're supposed to form antibodies. They're supposed to form antibodies. These antibodies are the ones that are supposed to attack the antigen, those antigens, which in this case are pathogens. So they are there to help us fight off infections. Now, these are usually disease causing, right? They are disease causing. Like I said, they are pathogens. Pathogens are disease causing agents. This is a normal situation. We get an infection in our body, be it a bacteria, be it a virus, be it a fungi, or whatever. That pathogen, when it enters our body and causes infection, our immune system should respond to it and produce antibodies against that. So in the event that, and those antibodies are supposed to fight the infection and clear off. They're supposed to fight off those pathogens and clear us off the infection, and we become well. Now, in the case of an allergy, you get an antigen that is not a pathogen, meaning it's not disease causing. That is not a pathogen. You get an antigen that is not a pathogen, but the immune system treats it like a pathogen and still produce antibodies against it. Now in this case, it's peanut. Now you ingest that peanut, and then the B cells, they still do the same thing. They secrete antibodies against this. Because this peanut is not an infection, so there's no inflammatory process or infective process that is happening in the body, because this is food. Because it's food, we are not supposed to be forming antibodies against food. But then these are our B cells. So they've now formed antibodies against the peanut, the protein in the peanut. Now these antibodies, they go to the mast cells and the basophils and start to attach themselves there. They start to attach themselves there. This is the first time this person has eaten the peanut. Now, the second time, so the first time the body has been exposed to an antigen, which is a peanut, the body started to form antibodies, and that's called sensitization. Sensitization. Now the body is sensitized to the antigen. The second time this person ingests the peanut again, that peanut will go there and attach itself there. And that attachment causes the activation of the mast cells, of those receptors. And the mast cells are gonna degranulate. Degranulate. And once they degranulate, they release a flood of inflammatory mediators. Inflammatory mediators. And the inflammatory mediator of note or of concern in this case is the histamine. The histamine. The others are your leukotrienes and other cytokines. So now you have a massive release of histamine, and this histamine is the mother of all the clinical presentation that we're gonna see, that we're gonna talk about now. I want to say this again before we move on. You have this person. This person has got his immune system. His immune system is supposed to protect him against pathogens, against antigens that are pathogens. Like I said, antigens are not all disease causing, but there are those that are disease causing, like those are pathogens. So this immune system is supposed, when there is an entry of a pathogen, this immune system is supposed to produce antibodies against that to fight off the infection. But now in this case, this immune system recognizes an antigen that is just a food substance. It recognizes it as a pathogen and forms antibodies against that, which is not right. That's why someone who eats a peanut, one person is going to get an allergic reaction, but the other doesn't get an allergic reaction. The one who is not getting an allergic reaction is because his immune system has recognized that peanut butter is, yes, an antigen, but is not a disease-causing antigen. It's not a pathogen. So I shouldn't be producing antibodies against it. Then the next person whom, when they eat a food substance, whatever food substance it is, or whatever medication they are injected with, the body recognizes that as a disease causing. So they form antibodies against it, which is not supposed to be happening. So that's why you'd get someone from grass, they get allergic reaction, from pollen. It's because their immune system recognizes these as disease causing. It recognizes these as pathogens, but they are not pathogens. They don't cause disease, but their immune system still forms antibodies against this. But those antibodies, they go and attach to the mast cell, and when the person is re-exposed now to the antigen that he has been sensitized to, the mast cells, they release a floods of inflammatory mediators, and the main or the problematic inflammatory mediator is histamine, which we're going to talk about in the next video. So please make sure that you appreciate this slide because it's very, very important. Let's meet in part 2, guys.